to everyone, and welcome to our workshop, Crack the Code, Introduction to Nutrition Calculations. I, Beenu Bhatia, consultant nutritionist with over 18 years of experience, including teaching, research, clinical, and industrial in the field of nutrition and dietetics, will guide you throughout today's session. We are thrilled to have such an enthusiastic group joining us to explore how mastering nutrition calculations can transform dietary planning and health management. Nutrition calculations, they may sound technical at first, but they are the foundation of effective diet planning, whether for the weight management or disease prevention or athletic performance or public health policy. So to kick the things off, let's dive into our first session where we will uncover the building blocks of nutrition calculation. Please join me in welcoming Dr. Lakshmi Kulkarni, Ayurvedic doctor with master's degree in clinical nutrition and dietetics with 15 years of experience in the medical and wellness field to take us through this exciting journey. So welcome Dr. Lakshmi Kulkarni.
Thank you, Beenuji. Hi, good evening, everyone. So how much are you all excited about the today's session? Can everyone unmute and say, or you can drop a chat, use the message in the chat or use a thumbs up. How much are you all excited about the today's session? That's great. It's good to see lots of thumbs up are coming in. That's nice. Yeah, just quickly, can I ask you all one question, everyone? What is the first word comes in your mind when you hear a word nutrition? What is the first word? What is the first thing comes in your mind when you hear a nutrition? Put it in the chat or unmute and say, no problem. What is the first thing that comes in your mind? Nothing? Something should come, no? Like when you are planning the diet, when you are heard about the nutrition word, somebody is talking about the diet plan. What is the first word that comes in your mind?
Calorie requirement.
Calorie requirement. Then nourish with food. Good mineral. Then only two things comes in your mind. Nutrients. Nice, Amol. Do you all know what comes in my mind? Health. Yes, Nita Matthew. Do you all know what comes in my mind? It's calculation. It's formulas. Nutrition and welfare for the body. Yes. So first thing when I think about the nutrition, when I think about the diet plan, the first thing comes in my mind is calculation, formulas. Okay. Nutrition or handing over the diet plan, it is not just preparing morning drink, breakfast, lunch, dinner, or mid-morning snacks. It is not just that. It is all about the calculation, how much nutrient should go into your body, how much nutrients is required for your body to nourish, how much calories are required for your body to give a fuel to your body, how much calories you need to burn to reduce the weight. So everything has a calculation. When it is the nutrition, when we are talking about the nutrition, it is full of maths. Right now, don't get scared that कहाँ पर आ गए हम, यहाँ पर भी maths सिखाए रहे हैं. It's a simple mathematics technique that we are giving for you all to make your clients to help you to build a professional diet plan without pushing them into any of the deficiencies, right? So that is the reason today's session all about the importance of nutrition calculation. You are going to learn how the calculation important for our body, how to approach a person, how to plan the personalized diet plan for them. It is not about just preparing the diet plan and giving it to everybody. It has to be personalized and understand how much calories are required for that particular body. Importance of nutrition calculation is it is essential for the weight loss program design. It is not only for the weight loss program design, it is also for the weight gain. Also, we are giving the weight gain diet. We are working on the muscle building diet. We are working on the athletic performance, right? And also crucial in managing chronic diseases. It may be CKD, chronic kidney diseases, diabetes, heart health, so many more, maybe chemotherapy, chemo diet, onconutrition, and the person is in the critical care, then the ICU care needs lot of calculation, how much the particular person gets the protein, how much he needs the amino acids, how much the parental nutrition should go. All this comes under the nutritional calculation. It is the key for help in improving your diet and helps in shaping the public health policy and meeting the nutritional goals safely without entering into any deficiencies. So that is the reason the mastering the nutritional calculation is very important for all the individual, the professionals, students. You must aware before you are learning something in the deep, the nutrition calculation is very required, very much required. It helps in building the dietary decisions, enhancing your health, performance, well-being, and the person, when you are giving the diet plan to a person who is looking for the weight loss, the person lost a certain weight, maybe 10 kgs or 12 kgs of weight or 15 kgs of weight. The another person is looking into them, they should tell that, yeah, you have toned up your body, you have lost a good weight. They should not tell कि कुछ बीमारी हुआ है क्या? Are you sick? Why are you looking so pale? Why are you losing muscles? If somebody is telling you are losing muscles, you are looking pale, it is the indication that somewhere the calculation is missing. Somewhere the micronutrients have not met. Somewhere you are compromising with the micronutrients. So to meet all these things that we need to understand the nutrition calculation. Nutrition calculation is required not only for burning the calories, not only for weight loss or weight gain. Why do we need energy? First, let us understand. The energy is required for breathing, circulation, organ function when you are at rest. So when you are at rest also, your body is not at rest. When you are sleeping also, your body is a machine, it never sleeps. There are hormonal changes are happening. Your heart is continuously working. Your brain, your nervous system is working. Your kidney is continuously working to remove the waste product from your body. Gut bacteria are continuously working. Your body is at work 24/7. Only you are sleeping, but your body is continuously working. There is a cellular transitional happening, DNA changes are happening, cell metabolisms are happening. For each and every work which is happening in your body, that requires energy. So we call it as the basal metabolic rate. I'll come to that part next. For the digestion and the absorption of food, for the absorption of the nutrients, for removing the waste product, and to repair your muscle, to repair your cellular injury, and the nervous system which sends the signals, and cellular transportation, intracellular movement, extracellular movement, respiration, biosynthesis to remove waste products from your body, and muscle contraction, body movements, each and every movement which is happening in your body that requires energy. The energy what we are giving, it should meet the every work which is happening in our body. For that, we need to properly do the calculation before we plan the diet. Okay. So then what are the factors which are affecting in the basal metabolic rate? The basal metabolic rate is the energy when your body is utilizing when it at rest. Heartbeat, breathing, thermoregulation, brain activity, your digestion, your the reproductive system is working, the hormonal changes are happening. All these require certain amount of energy. Whenever we calculate basal metabolic rate, we need age, gender, height, weight, and muscle mass. When the muscle mass is higher, so we call it as the body composition analysis. When we are doing the body composition analysis, when the muscle percentage is higher, you will be having higher basal metabolic rate. When your muscle percentage is lower and the fat percentage is high, you will be having lower basal metabolic rate. Your basal metabolic rate always depending on the muscle mass, and the calculation which we do, it is considering height, weight, age, sex. Depending on that, we do the basal metabolic rate. Then how the basal metabolic rate? What is the total daily expenditure? Kitna mujhe khana hai? How much the energy is required? That we are deciding from the calculation. The calculation starts from here, guys. And as Ankita told, hope all of you are ready with your paper, pen. And one thing I want to add is the calculator. If you have a small calculator, or use your mobile calculation, because we are doing some calculation in the next slide. Total daily energy expenditure. How much energy we are expending, how much energy we require, how much energy we need to take it from the diet. It is composed of three factors. One is the basal metabolic rate, the energy which are utilized for the when your body is under rest, physical activity level. Without the physical activity level, your total daily expenditure is not complete. Another factor, important factor, is the thermic effect of food. What is this thermic effect of food? Thermic effect of food, basal metabolic rate mein nahi aata. It won't comes under the basal metabolic rate. It is the separate entity that we are having. Without the thermic effect of food, you will not be able to know how much calories required for your body. Then what is the thermic effect of food? Thermic effect of food represents the calories burned to digest, to absorb and store the food. That is the thermic effect of food. The thermic effect of food is the calories utilized for the digestion, absorption and the storage of food. Highest the thermic effect of food helps in the better weight loss. Moderate thermic effect of food will help in the maintaining the weight. Lowest thermic effect of food help in the it increases the weight. Then what are those thermic effect of food which contains the highest, moderate and lowest? Highest thermic effect of food are nothing but proteins. Proteins and fibers are having the highest thermic effect of food, which is around 15 to 20% of TEF. So which are helps in the better weight loss. These food are giving you the better weight loss. Moderate thermic effect of food comes under the 10 to 12%, which are the complex carbohydrates and the fiber. Complex carbohydrates in the sense the millets, unpolished rice, unpolished dals, what you are taking, those are the moderate thermic effect of food. Lowest thermic effect of foods are the fat, oils and the refined products. Highest thermic effect of food comes under the eggs, lean meat, example chicken, meat if you are taking, all this comes under the highest thermic effect of. If you are planning weight loss diet for any of your client, you need to focus on the highest thermic effect of food, which will help in giving the fibers more, which will help in giving the highest satiety, help in the weight loss. If you are planning to maintain, and when you are combining the diet, then you need to go with the highest and the moderate. But whereas the lowest thermic effect of food, which are the invisible fat, visible fat, and the fat, oils, ghee, butter, which are having the lowest packaged food, we tend to consume it more, and that increases the obesity. So first, you should aware which food contains the highest, moderate, and the lowest. Once we know the previous slide, Binuji. So first, the total daily expenditure comes with basal metabolic rate, multiplied by the physical activity level, and we need to add thermic effect of food. Then question comes, how much thermic effect of food that we need to add? We are not going 10 to 12 because nobody is just taking the high protein diet. So always it will be a combination of high to moderate thermic effect of food. Generally, what we need to add is the 7% to 10% of BMR should be added into the basal metabolic rate and the physical activity. So once we get this, we are getting the total daily expenditure. So this is your calories. Okay, next slide. So once then coming to the basal metabolic rate, how do we need to calculate the basal metabolic rate? The basal metabolic rate, we use the three types of calculation. One is the Harris-Bendix equation, Mifflin-St. Jeor equation, and third one is the WHO or FAO equation. The Harris-Bendix equation, Mifflin-St. Jeor equation, it gives the calories based on age, height, weight, and gender. Whereas the WHO FAO equation, you can see in the table number 5, it has the calculation which consists of body weight and the age. Okay. So now what we need to do, how to calculate the total energy expenditure? First, we need to come to the, let's go with a simple calculation. Here we have given the WHO recommended equation because which is very easy to calculate in the session now and which is widely used, and what we need to do is for the public health awareness and all, this calculation we are using. Otherwise, when we are going with the personalized diet plan, personalized approach, the most widely used equation is the Harris-Bendix equation. So I want everyone to open the pen and paper. Let's do the calculation. First, what we need to do is, we are doing the WHO equation. The WHO always consider the sex, male and females, the separate calculation is the 18 to 31 calculation, 30 to 60 age group 1 calculation, and more than 60 we get 1 calculation. Similarly, 18 to 30 females 1 group, so 30 to 61 group, and more than 61 group. So this is how the FAO or WHO equation. Whereas Harris-Bendix equation is the completely personalized. We need to give body weight, height, as well as the age of the person to get the particular person's calories requirement. Let's all go with the simple calculation here. I want everybody to open the book, pen, and use your calculator. Once you are ready, just give a thumbs up. We will do a calculation together. Can we start the calculation? Perfect. So now I am starting with the male. I'm taking the age group of 18 to 30. Okay. Everybody open your calculation. Even I am opening my calculator. So now take it 18 to 30. The formula is 15.1 into body weight plus 692.2. Okay. Now 15.1 into, take the body weight as the 60 kg and put it in the formula 692.2 and tell me what is the basal metabolic rate that you have got. What is the BMR you got, guys?
$97.5.2.
No.
1598.2.
Yeah, we got the answer, 1598.2. Correct, Suprita. Good, Amina. Now we got the BMR, right? Let me go back to the previous slide. Binuji, previous slide. Now, what you need to do is 7% of 1598.2, which is the TEF. 7%. You can take the roughly approximately as 7% of 1598 7% of BMR. How much you are getting? Seven percentage of 1598.2.
Ma'am, 111.874.
Perfect. Perfect. It is 111.87. Let's take it as 111.9. Okay. Now we need to calculate the total daily expenditure. First, put the BMR, which is 1598.2. 1598.2. And the physical activity, consider it as a 1.2, which is the sedentary. Next slide, Binaji. Take the physical activity. For the sedentary lifestyle, we are adding 1.4 in a physical activity level. For moderate activity, it is 1.8 and 2.4 or 2.5 for the heavy physical activity. Now we are taking it as a sedentary, multiplying with 1.4. We are getting the 2237.48. To this, we need to add 111.9. How much total daily expenditure we got? What is the total daily expenditure we got? Perfect. Minal, it is 2349.
2,349.
Everybody got this answer?
Yes, ma'am.
Yes. So now this is the calculation. This is the BMR, total daily expenditure we got. This will help us to maintain that particular weight. If the male wants to maintain their 60 kgs, this much amount of calories that we need to give it for them. Suppose we are targeting for the weight loss, the 10 kgs weight loss or the 15 kgs weight loss. If we are targeting, then we need to go with the deficit diet. Maybe 5% deficit, जो भी हमारा final outcome आया है total daily expenditure में. We need to decide how much weight loss you are targeting. Based on that, we need to give 5% deficit diet or 10% deficit diet or 15%. Not 15% would be very more. 10%, depending on how much weight that you want that person to reduce. Accordingly, we are giving that deficit. Similarly, if you are working on the weight gain, then we need to go with the surplus diet. So now we got the total daily expenditure, everything. We need to divide it, right? How to divide that we need to discuss. It needs to be divided properly. Macronutrients, how much macronutrients that should go in the particular diet, that we need to decide. Now I want to hear it from everyone. Are you all perfect with the simple calculation what we have done so far? Are you all clear with the calculation? Yes.
Yes, ma'am.
If you see the table 5, there is a 18 to 30, 30 to 60. You can see that there is a decrease in the calculation. If you give the same 60 kgs with a different age group, you will see the reduction in the calories, reduction in the basal metabolic rate. The reason is, as the person ages, his fat percentage start increasing. When the fat percentage start increasing, his basal metabolic rate start coming down. You all have a picture on the screen. Maybe you can try with the different age group, keeping the same 60 kgs. You will come to know how the BMR is getting reduced with the age. Similarly, you can do it with the female patient. If you see the 692.2, we are adding it in the 18 to 30. Similarly, we are adding 486.6, same age group, 18 to 30. The reason is the female is accumulating more fat compared to the male. Male is a more muscular in nature and he requires more calories compared to the female. So that is the reason that when we are comparing the BMR, always there is a difference in the BMR, what we are getting for the similar age group of male and similar age group of the females. This is how it gets changed. Now I'm handing over to Ankita. she will be taking the session on how the macronutrient distribution will happen. Okay, so now enjoy learning more how we can distribute the macronutrients. Thank you. Over to you, Ankita.
Yes, thank you, Dr. Lakshmi. So, all right, again, one quick question. Why do you think that it is important to understand the macronutrient distribution? You all can either unmute or please drop it on the chat quickly. Why do you think, like, okay, एक बार calorie तो समझ में आ गया कि चलो उसको 1500 या 1700 calorie देना है diet का बना के. But macronutrient distribution क्यों जरूरी है? Why it is important to calculate macronutrient? What is the importance does it stand? If you can just unmute, let's say, or just put it in the chat quickly. Nobody? Why do you do micronutrient distribution? Have you all tried using these calculations? आपने कभी diet plan बनाया है कभी आपने? Okay, to prevent deficiency. Okay, that's one. So we're talking about macronutrient. उसका distribution calculations क्यों जरूरी है? I mean, what is it more important rather than again one avoiding deficiencies? Yes, one way of looking at it. But what are the other important aspects? Yes, Krish.
Ma'am, to prevent spikes in blood sugar levels and to improve the absorption of proteins.
Okay, so in a
effectively.
nutshell, yes, that means we all term it as like hormonal balance, metabolic. So in short, it is metabolism because it affects our metabolism. Slow, great. Okay, very nice, Suprita. Development, yes. So when you look in terms of malnourished people, yes, we are looking more of growth and development. Okay, to have balanced distribution, yes, that's one goal because not everybody will come with you with either fat loss or weight gain or muscle gain or fat loss. There'll be a lot of people who are just coming in for your general fitness and they just want to improve their eating habits probably. So that's the reason it is very important to understand the macro distribution. Second thing, where there is a various field where you can apply this macronutrient distribution based on an individual's goal specifically. Say for example, उसके लिए एक base, Viraj, can you please unmute? So because of this, we need to understand the baseline. So there is a certain guidelines, which is a baseline, which is given with WHO and the US standards. Now, based on that guidelines, depending upon a client's goal, whether it is weight loss, whether it is fat loss, whether it is a clinical condition, whether it is a condition which is associated with any lifestyle disorders, is something or a sports condition, it will help you to adjust your percentages in terms of the macro distribution. Because okay, tell me one thing, will you the WHO has given certain guidelines. क्या आप सबको एक जैसा macro distribution दोगे? Like say for example, एक female आ रही है 18 years की, एक female आ रही है 30 years की. Okay, both they are not having any condition. They just have come for you for simple weight loss. दोनों को 1400 calorie की requirement है as per the whatever calculations and all that. क्या आप दोनों को एक जैसा macro distribution दोगे? Yes or no? No. Okay. So Suprita, why you feel no? If you can just quickly unmute and say, why do you feel no? Why will you not? They have no conditions. They have purely just come for weight loss. They stand absolutely no deficiencies. They have just come you for normal weight loss. One is 18 years, one is 30 years. Why will you still not change or adjust the macronutrient distribution? Your answer is correct. Even Richa has answered correct no. But why no? No, I'm talking about the BMR set. एक का BMR है सही. I'm talking about the distribution of macro. जैसे, say for example, standard distribution is basically. So we'll go on the other slide to understand our different. Yes. So everybody is different, right? So I will not give the same distribution to both the girls or both. I mean, one is 30 years, one is 18 years. दोनों का metabolism अलग रहेगा. Obviously, a 18-year will have better metabolism than a 30-year-old woman specifically. So based on the baseline, what kind of macro distribution you should be giving as per the dietary intake and the previous health conditions and the metabolic conditions, you will decide what distribution you will give. So let's understand first about the macronutrient, the baseline first. Bridget, can you please go to next slide? Yes. So now the acceptable micronutrient distribution, okay, will range as, now this is the base which we take as the base. So for carbohydrate, we keep it to 45 to 65. This is the baseline. Proteins, we keep it 10% to 35% of the total calories, and fat, we will keep it to 20 to 35%. Now, this is the standard ratio which we will keep as per if individual is having no goal, but just for healthy eating, and depending upon the dietary intake, we will have to adjust whether to give 45, 50, 65. That will have to take call based on dietary. Now, tell me one reason why is taking dietary recall important to set the macros also, irrespective when the standards are already set. If anybody can unmute and tell me why it is important to take a client's dietary recall first, apart from working with all the technical calculations which we are doing over here. Why do you think, okay, do you think is it important or it is not important to take to consider a particular intake, dietary intake? Yes. So why, Richa, why do you say it is important? Yes, Amol, why it is important? Why do you think it is important? Baseline तो already हमें दिया हुआ है ना, तो हमें dietary recall लेने की क्या जरूरत है? हम तो वैसे भी स्टैंडर्ड के साथ जा रहे, तो ऑब्वियसली रिजल्ट्स तो आने वाले, राइट? ओके, फूड हैबिट्स, ओके, माइक्रो इंटेक भी जाना जरूरी है, बट स्पेसिफिकली मैक्रो इंटेक के लिए क्यों जरूरी है वो? Okay, food selection. Okay, now when you say Amol, food selection, what kind of food selection you're talking about? Okay, Suprita says that we'll understand where they are lacking. Okay, fair enough. So, okay, all the answers are right. Yes, good quality of food specifically, yes. So say for example, even if say a person is say eating too much of simple sugars, भले ही वो 60% खा रहा होगा, which is as per the requirement, but वो 60% में से आपको कितना फाइबर देना है, कितना परसेंटेज फाइबर को वेटेज देना है, कितना परसेंटेज सिंपल कार्बोहाइड्रेट्स को देना है, और कितना वेटेज कॉम्प्लेक्स कार्बोहाइड्रेट को देना है, that only a dietary recall you'll be able to understand with specifically. Same way with the protein intake. If in the recall you understand the client is not even eating say 10% or 15% of the dietary allowances, will be when you go deeper in the courses, we'll be also doing the RDA. So the references which a particular person needs. Say for example, if it is a completely non-sedentary person, we calculate it as normally 0.8 grams per kg body weight. So now when you understand कि वो उतना भी नहीं खा रहा है जितना minimum requirement है, और आप उसको सीधा 30% 40% intake protein को बढ़ाने दोगे, it will be a very unpractical approach. So also when you work with individual clients to have a more practical approach, it is very necessary to understand their intake in terms of everything. The micronutrients, the macronutrients, the fiber intake, the water intake. Obviously, we do not calculate too much of water, but I think, yes, that also stands very important when it comes to weight loss, when it comes to other aspects of clinical aspects. So that's very important to understand. Also in terms of, Binoji, we can move on to the next slide. All right. Also, the focus is on preventing obesity, all right, and the other non-communicable diseases. Also, broadly alignment with the MRDAs, more perspective on fat and carbohydrate quality, as Amol said. The quality of food matters. We do not want to have too much of simple sugars because, as Dr. Lakshmi said, that the thermic effect will not be that effective if you're looking from a weight loss perspective specifically, or from an athlete perspective where he needs a little more energy in terms of, and a little more fat burning, where his goal is to burn fat specifically. Because from an athlete perspective, you will not be too much of weight loss. Yes, some people may come to you if they want to get trained into a certain category of weight, then yes, but some people will just come to you to improve their body composition. So this is where even your metabolism factors come into place. So it's more important to understand the quality of carbohydrates which you'll be giving specifically, and also the fat. Like we all know that fat is also subdivided into your saturated, unsaturated, trans fat. So you understand that out of the total 30%, if you're giving, आपको आपको ऑलमोस्ट ना के बराबर ट्रांस फैट देना है. Saturated can be 10%. Other 20% you can divide into PUFA and MUFA, which is monounsaturated and polyunsaturated. So again, there is a lot of diversity. There is also a lot of anti-inflammatory foods which are added in the food, because obviously inflammation also one of the in today's day, irrespective of your heart diseases, your injuries, when the inflammation is high, you have to make sure that you're giving anti-inflammatory foods also. So that's how it will help you to monetize and personalize your diet intake. Obviously, and Guruji, we can move on to the next slide. So, as we discussed, the simple calculation will be 45 to 65% for total carbs. Protein would be somewhere between 10 to 35. I would say 15 to 30. It's 15 to 40. You can keep depending on this thing. 10 would be still too less in today's date. Total fat can be, yes, between 20 to 35%, depending upon what type of diets you're doing. We will do some calculations in coming slides. And again, saturated, trans, and the free sugars. So free sugars, we already spoke about, it will be considered into simple sugars into the carbohydrate section. All right. Now coming to our next. Now, why we'll just understand a little bit more of the macro distribution in the clinical nutrition therapy. All right. So it could be either in managing obesity, it could be diabetes, where the quality and the quantity of food both will matter for sure. Then support your reducing your heart disease, where again your fat percentage, how much you're giving, it will matter. So we will just do a simple calculation. Now consider a client has come to you with 1800, which is a total calorie requirement which you're there. Now he needs a weight loss. Now say 1700 here I'll take a very easy numbers to calculate for you so that you'll understand the basics of why this distribution, how you can do up and down and play around with it. 1700 is a required this thing. 10% deficit karke, how much is the calorie requirement you will give him for weight loss? We start with a 10% of deduction, starting with 10%. We will not straight away go to 5%, which will be more or less, considering he's too overweight. He's almost 30 kg overweight. So if we consider 1700 ka 10% pakadte hai calculation, it will come around, or 1500 ka agar pakad lo to be easy, say 1300 ka calorie diet aapko banana hai. Now in this 1300, you will give 40% to carbs, 30% to protein, and 30% to fat. Just calculate and tell me what will be the calorie distribution for each. 1300 is the chart which you have to make. The diet plan has to be 1300 calories in total. जहाँ पे carbs को 40% रख रहे हम, protein को 30% रख रहे and fat को 30% रख रहे. So just unmute or type on the chat and tell me what is the calorie distribution which is coming.
And 520 kilocalories for carbs.
Yeah, so 520 for carbs, or protein or fat kitna aa raha hai?
390.
390, correct. Now we know how much per gram calories this carbs gives you.
4 kilocalories.
Sorry,
4 kilocalories.
4 kilocalories. Protein will give you 4 kilocalories and fat will give you
9.
9, right? So आप इसको 520 को you will divide by 4 to get your grams basically. So that much amount of grams you will give it in terms of your carbohydrate, right? Same way, 390 you will divide it by your 4, which will set your protein grammage. And same way, 390 divided by 9, which will give you your fat grammage, right? So this is how you'll play around with the normal case. Now, इसी कोई अगर अभी मुझे ketogenic diet में रखना है, say for example, I plan to give a person, now his blood parameters are absolutely normal. He has no uric acid problem, he has no lipid profile problem, and he's a very normal client and come for a keto. He wants to do a keto diet. Okay. Now, why do you think when a person comes for keto diet, we need to also correlate with the blood parameters? Can anybody unmute and tell me? Or is it even important to tell a client to undergo a blood test when somebody is asking or insisting too much on a keto diet?
Yes, ma'am.
Say for say any other diet, I would say. I mean, as per a good coach or good nutritionist, do you think is it important to also with the diet recall to understand the blood report or a blood profile of a client?
Yes, ma'am.
Why, Krish? Why it is important?
Ma'am, if you are particularly recommending keto diets, we should check the levels of ketones in our urine because it can lead to ketoacidosis condition if
That is
blood
okay, but client is okay. That's one way of looking at it. But what has cholesterol levels or the cholesterol levels to do in relation with the keto diet?
Keto diets are usually like high fat, high protein diets, right? So you should be knowing what is their fat percentages or
Correct.
total
Yes.
cholesterol and
Great.
other fat markers.
Wonderful. Amol also says that because of high saturated fats specifically. So, all right. So now we just take a normal scenario where a keto diet is to be given, where the blood parameters are absolutely normal, and a client is insisting on a keto diet. Now, based on his again on his history, on his blood history, his family history also. Say, for example, I want to plan a 1500 kilocalorie diet where I am giving carbohydrate 50%, protein as 30%, and fat as 20%. So this is one calculation I can give depending upon the client. Normally, if a client an athlete perspective, I may even increase the fat percentage, or I may keep the fat percentage same. I may keep a little protein to 40% depending if it is the goal is bulking specifically, and fat carbohydrates to as minimum as 15% also. So that is a reason why it is very important to understand your micronutrient distribution as a baseline and then play around with the numbers on case to case basis, which will then we can term as a lot of personalization diets, which we call as. Again, what is another major important thing when we work on these macro distribution? This is one way of looking at it as a primary goal and a secondary goal. But why do you also need that, we need to understand what we are giving as the baseline and then the progressions? Why do you think it is important on the later stages? If anybody can unmute and say adaptation. Okay. Amol, when you say adaptation, what do you mean by adaptation? That's okay. Weight loss, I understand. Adaptation is I understood that client is just getting acquainted to a certain progression diet, right? So I was expecting an answer in terms of the progression diet. So what happens is if a client is coming you for a 1 year of a coaching, say for example, right? We don't want a client to come only for 3 months. If the goal is bigger, obviously he will need more number of months to come and to be with you and to transform with you. So obviously at one go, you cannot give all the calculations. You'll have to go on a progression. You have to give him progression diets. How will you diet? How will you tweak the percentages is on the progression basis, basically. Say, for example, now you have kept the protein at say 25%. Then you can increase it to 30%. You can reduce the carbs. You can keep the fat same. Same way, another 6 months, you can, as the protein intake improves, his body composition is improving, you can make protein to 40%. And that's the importance of your macronutrient distribution, basically, also for your progression diets. All right, Binuji, we can move on to the next slide. So we already spoke about it in terms of irrespective of the different diets which we want to give, whether it is a Mediterranean diet, keto diet, low fat diets, your personalized nutrition in terms of the progression diets and athlete based specifically. Viruji, we can move on to the next diet. Yeah. So in terms of athletes also, uh, somebody is coming with a very good body composition. The BMI is already 18. The body fat percentage is already like somewhere around 18%. But he wants to do a body shoot and he wants to drop his body percent from 18 to 15%. So this will help you to play with the numbers in terms of the progression also and as per the individual's goals. And that's the reason it is very important to understand for us. Same way, post-recovery surgery diets, your protein will stand the utmost importance. We will be seeing when you undergo a proper course, we will also understand the amino acid profile, which also needs to be taken care when you're giving a good protein diet also. It's just not only about the protein. And that's the reason it is very have a very deep knowledge about the quality of proteins, the type of protein. When it comes to athlete, the timings are very important. Your pre-workout, post-workout, your recovery diets. So depending upon all these things, your macros will keep changing upon from goal to goal specifically. And that's where you'll be calling into a personalized diets basically. All right. So that was more about how do you calculate your BMR, the total energy intake, and based on that, your distribution. Now I hand it over to Binuji for the further calculations to understand more how do we do the exchange list and everything. Over to you, Binuji.
Yeah, thank you, Ankita. Ankita is a seasoned clinical and sports nutritionist with over 14 years of experience in nutrition and dietetics. Thank you, Ankita, to enlighten us about macronutrient distribution and AMDRs. So I hope they had broken the iceberg for the macronutrient distribution. Okay, so next, coming to this calculation part, next is a like very simple ideal body weight. So every person has this view that what is our ideal body weight, how to calculate that. Now this ideal body weight, this is a very traditional measure used to estimate a healthy weight based on height. Now this is the only measure which is based on height basically. Sometimes sex and sometimes body frame size is taken into consideration, but most probably the height is the thing which is considered in this kind of calculation. Now, the common formula which is used for finding out the ideal body weight is your Broca's index. And this is also used in the clinical settings to guide nutrition prescriptions, especially for dosing medications or setting protein and energy requirements also. But there's an issue with the ideal body weight also. Like, unlike actual body weight, which can fluctuate with fat and muscle mass, because as from the starting we are studying like that every individual is different. Every individual's body, like the fat mass or the muscle mass is different. So actual body weight fluctuates with fat and muscle mass. So ideal body weight is a theoretical standard designed to help clinicians assess all the nutritional status or guide interventions also. And your ideal body weight has practical applications also in clinical nutrition, majorly for like dosing certain medications or estimating calorie needs or evaluating patients with obesity or underweight conditions also. And other than that, like they have the relevance in the easy to calculate with special tools basically. They don't without special tools basically, they don't need any extra tools. So if you're not having anything in your hand and if somebody is asking you a question about the ideal body weight, so you are easily able to calculate and give them the answers regarding this. So still occasionally used in some clinical and fitness settings as a rough guide. Now so we were talking about the Broca's index, and this is the only formula which is developed by the Paul Broca in the 19th century to estimate ideal body weight based on height. So Broca's index is one of the oldest and the simplest formula to find out the ideal body weight. Yes, there are the limitations, as I have already told you, that because in this we don't consider age, we don't consider body composition, and there's a lot of differences in the body composition of the same age group, same gender. So there's a lot of different body composition. So we have to consider all those things also. Now this is less accurate for a very tall, short, muscular or elderly individuals as their body composition differentiates. Then largely nowadays it is replaced by BMI. So BMI is much more authentic way to find out the weight, and more advanced methods which includes your body fat percentage, waist to hip ratio, and DXA scans also. So next, coming to the, as we were talking about the BMI, so coming to the BMI, so BMI is your body mass index. Now this is the better way to find out like in which category our individual is. Simple formula: weight in kg divided by height in meter square. This is the simplest formula to find out the BMI. So as you can see in the slide also, this is the simpler formula which has been used. And you can also use this formula to find out your BMI. So I hope everybody can, already you people are having your pen and paper. So you can find out your own BMI and you can find out like where you stand. So in a table, if you can see, this is the classification. This is the cutoff of the BMI. Now this cutoff of the BMI, this is for the Asia Pacific people, basically for the Asians like we Indians. And WHO has also they have given the two cutoffs. One is for the Asians and one is for the Western population. So we belong to the Asia, so we are using the Asian cutoff only. And as per the cutoff, if you can see, there is a classification. If your BMI is less than 18.5, you are underweight. If your BMI is between 18.5 to 22.9, you are normal. If it is more than 23, overweight, and from 23 to 24.9 at risk, then your obese 1, then your obese 2. So these are the major cutoffs. So can you go through your these calculations? Can you do this calculation of finding out the BMI? And you can answer in the chat box. Are you people doing? This is the simplest method you can use. Anybody who has calculated? Yeah, Meenal. So Meenal's it is 19.6. So basically she falls in the normal weight category. As you falls under 18.5 to 22.9. So like this, you can calculate your BMI and you can know that where you stand. And as this is the same thing which is used with the patients also. We use the same formula for the patient also. Okay. So other people have also calculated or not. There's no need to tell if you don't want to, but calculate, do the calculation and understand that how it is calculated basically. So have you done? Say yes or no. Don't give me the answer about that. Pooja, you are underweight. It's very low. Take care of your health. Okay. Okay, so I think everybody has calculated. So Prita, that is 22.6. Okay, you are also in a normal range. 21.1, you are also in a normal range. So now you know how to calculate BMI. Okay, so the next we will be talking about understanding nutrient requirement guidelines. Now I would like to welcome Miss Tanveer. She is a nutritionist and a clinical dietitian with 20 years of experience across hospitals in India and Middle East. And she will reflect light on the nutrient requirement guidelines and food composition tables. So over to you, Tanveer.
Thank you, Binuji, for your introduction. Hi, everyone. I'm Tanveer. So hope you understood all calculations about calories, TDEE, ideal body weight, BMI, and macros. So we will discuss here about nutrition guidelines, which we have to follow. So I would like to ask you a quick question that if you are designing a diet, then how confident you are when you are designing a diet that your nutrient values are accurate or just approximate? You can answer in the chat box. So are you confident when you are designing a diet that your nutrient values are accurate? Not confident, Pooja said. No problem, it happens. It happens that we are not confident, and because of that, we have come with this course on calculations. and we need to follow about nutrition guidelines which are there for Indian people and global population too. So as you know that when we are calculating diets, even if 10 to 15% calculations are wrong, then it can play havoc on health of our clients. If a person is with diabetes and his blood sugar is not stabilized, if we are wrong in our calculations, then he might have to struggle for long enough. So to avoid that, we would better follow nutrition guidelines, which are there present in ICMR, NIN, WHO, and FAO organizations are giving these guidelines. So what happens, like most of the time when we are calculating, then we are using outdated charts or old rough estimations, but our nutritional needs change with time. Our nutritional needs change accordingly with age, with sex, and with our health status. They change. So when we are giving our nutrition prescription, we have to take these things also into account. As you all know that guidelines, nutrition guidelines play backbone of evidence-based nutrition practice. So we will just discuss that why this is required. This is to just develop evidence-based strategies for ourselves so that we are able to prescribe our nutrition plans with more accuracy, and we avoid undernutrition and over supplementation for our clients. Okay. So when we are following these guidelines, then we are winning trust of our clients too. So in case of like clinical conditions, when we are prescribing with calculations, then we are more confident and we win trust of our clients when we design diet for nutrition and kidney disease or in diabetes people. So we are more confident. So here, like organizations which work for these guidelines are, we have discussed already about ICMR, NIN, and international organizations are FAO and WHO. So nutrient reference values, we will just talk about these things. So it will, when we will follow these things, RDA, EAR, AI, and a tolerable upper intake level. So what are these? We'll take these into account. Like for a recommended dietary allowance is RDA, and RDA is taken for a specific group of population to cover about nutrient requirements of 97 or to 98% of healthy individuals. And secondly, this is estimated average requirement. So this is taken to just collect for the food supply requirements of specific population. So 50% of healthy individuals are taken into account. So on basis of EAR only, RDAs are established for the specific population. We need to know about food supply, how much food supply is required for the population, and accordingly, we just organizations give recommended dietary allowances. Then there is adequate intake. So when we don't have sufficient data for the healthy population to establish an estimated average requirement and RDA, then we take adequate intake into account. So it's like approximation of nutrient intake by a group of healthy people. Then we take into account tolerable upper intake levels. So we do not exceed nutrient levels, so it reaches toxicity levels. So there are some practical tools which can help. Some softwares are also available to calculate these through these guidelines on ICMR website, on WHO websites. We have IFCT also there, so which will give you more accurate calculation of nutrient values. DRI calculators are also there for dietary reference intakes, which we can calculate from USDA, or it can help on various parameters of the individual. So IFCT guidelines, I'll just show an example. Next slide, please. So why IFCT is important? See, IFCT is important because it helps you to analyze nutrient values of particular person. You are able to analyze nutrient values as like, I'll give you instance of one case. Like there was a client of mine. She was not able to reduce her weight when she was following online weight loss diets, several weight loss diets that she was following. And after that, she came to me. She told me that I'm desperate and I'm not able to just reduce my diet. My energy levels are going down. I'm not able to reduce my weight. So what should I do? So I just analyzed her diet, and according to IFCT, I planned her diet and corrected her energy problems and deficiency problems. So because of that, energy levels were higher and her deficiencies were corrected. You can analyze whether she is taking proper vitamin D, calcium. So I just corrected with it. So what is IFCT? This Indian food composition table, and different composition tables are there across the globe also. So in India, we use this IFCT, which is given by NIN. So for a particular food, 100-gram edible portion, macro and micronutrient values are given. So it covers all energy, protein, fat, carbohydrate, vitamins, and minerals for a particular group. And preparation method is also given. For example, boiled potatoes. Next slide, please. I think examples are given in next slide. You can see over here, like for rice, when we are taking polished rice, it's very detailed description is there of wheat flour, whether it is whole or it is refined flour. So spinach, raw form, cooked form, potatoes, boiled or baked. So these calories, proteins, your carbohydrates, your fats and carbohydrates, these are given. And apart from that, micronutrients are also available so that you can correct deficiencies of your clients. So with IFCT, we can just prescribe our diet with more precision. So from approximation, we can move towards precision nutrition. So in our course, we'll have result-driven studies where we will give you worksheets, we will practice with case studies, and we'll give you templates to help you with your diet planning. So you can see that we have to master key concepts of these recommendations, RDAs, EARs, and AIs, which is fundamental for all accurate nutritional calculations and effective dietary planning. And proficiency with IFCT, you will learn. And if you'll be able to design nutrition interventions that can change lives for you. Okay, so you can change lives of your clients. So if you want to change lives of your clients positively, then this course is for you. So remember, nutrition is just about numbers, and you have to practice that, and mastering calculation is very essential. So let's move forward for exchange table. Over to Binuji now.
Thank you, Tanvi, for enlightening on this IFCT. So next, we will be going through the food exchange system. Now till now we have studied like what is BMR, how BMI is calculated, how your total energy expenditure is calculated, then how macro distribution will be done. So we have already covered a lot of things under this. Now, next is the food exchange system. So as Tanveer was also saying, and everybody is saying over here, nutrition is not just giving you like what to eat in the morning, evening, or dinner. That is not the nutrition. Nutrition is a proper science based on all the calculations. And under those calculations, we prescribe what have to be eaten and what has to not to be eaten. So coming to that, now what is exactly food exchange system? Now in India also, like we have a range of food groups. We have a range of foods available in India. If we are talking about in India, otherwise also in world also there's a lot number of foods which are available. Now basically a food exchange system, this is a meal planning tool. Now this is a very, very important tool which is used for meal planning. And in this, what we are doing is the food groups, they are categorized based on their macronutrient content. So as we have earlier discussed, we have discussed that macronutrient distribution is based on your major macros: carbohydrate, protein, and fat. So over here also your food groups, they are categorized based on the macronutrient content and their calorie value. So foods within the same group, like with whatever the foods within the same group are. Suppose if we are talking about the cereals, under the cereals we get bread, we get wheat flour, we get millets, we get rice. So all these come under your cereal. So that means that is the same group, which is almost providing you equivalent amount of carbohydrate, and it is also providing you equivalent amount of calories. So that same group will be like labeled as a exchange list. Like one exchange, if we are taking about rice, then it can be exchanged with your one chapati or one slice of bread, depends. So that can be interchanged because they provide similar nutritional value. Okay, now what is the purpose of food exchange system? So as I have already told you that this helps individual to, like, majorly for those individuals who are suffering from the metabolic disorders such as your diabetes, your obesity, hypertension, or other metabolic disorders also, to plan the balanced meals. One thing is this, and it provides flexibility by allowing the substitutions, as I have just explained you, within a group without changing overall nutrient intake. Now, what is the relevance in the nutrition? Now, it is widely used for the medical nutrition therapy, particularly. Now, it is the major role played of food exchange system is in for the diabetes management and for your obesity also, plus your insulin resistance also. So all these problems can be sorted out by using the food exchange system, and it will help a lot to the patients suffering from many disorders such as your PCOS also. So it encourages variety and flexibility while maintaining consistent nutrient intake. So coming back to this food exchange, see, now you can see in this table, all these are the food groups. So when we are talking about the food groups, the things which I was just telling you about, like see, cereals. Now these all are your energy giving food groups. So if we are talking about the cereals, so one exchange of the cereal that amounts for to 20 gram, and that will be giving you 75 calories, and it will give you 2 gram of protein. It will give you 15 gram of carbohydrate. Okay. Now 15 gram of carbohydrate from any of the cereal, one exchange of cereal. That means 20 gram. So 20 gram of rice is also giving you 50 gram carbohydrate, 20 gram of one chapati, 20 gram of flour, which give you one chapati, that is also giving you 15 gram of carbohydrate. One bread slice, approximately 20 to 22 gram, that also gives you 15 gram of carbohydrate. So it's the same for all cereal group, all the foods which are coming under the cereal group. Similarly, roots and tuber, they are giving you 10 gram of carbohydrate. Sugar and jaggery is giving you 5 gram of carbohydrate. Fats and oils, they are not giving you carbohydrate, they are giving you fat. And your oil seeds, again giving you the fat. And then coming to the bodybuilding group, these are the protein rich food. Now, like we are talking about the milk and skim milk, they are giving you for the milk, it's approximately 12, and for the skim milk, 15, depending. Now, for the pulses, it is if we go for an individual pulses, sometimes it is from 14 to 14 to 17 to 18 gram also. But on an approximately, like pulses, one exchange is going to give you 17 gram, and then your 17 gram of the carbohydrate, but they are based on the protein. So for the pulses, like they are giving you 7 gram of protein. So this is your bodybuilding group, which gives you protein as the major nutrient. Okay. And similarly for the meat also, it's 7 gram. Then comes another group, that is your protective and regulatory group. All your green leafy vegetables or other vegetables or fruits, they are approximately giving you, vegetables give you a very less amount of carbohydrate. Approximately it counts as a negligible, and the fruits give you 10 gram of carbohydrate of one serving, which amounts for 80 gram. Basically a small apple, if we say. Okay. So this is the exchange list which we use. Now, this exchange list is very, very important to be used for the patients suffering from diabetes. And carbohydrate counting, if we talk about, that is an important part when we are planning a diet for the diabetic patients or people who are suffering from insulin resistance or people who are suffering from PCOS. So it's very, very important to do the carbohydrate counting in that cases. Okay. So the next is in the next slides, we have a few example also. And after this, we will be doing one or two queries also based on exchange list. So for example, how it works basically, like one exchange of the starch that is giving you one slice of bread that is equivalent to half cup of cooked rice, or 15 gram of that is all equivalent to 15 gram of carbohydrate. Now similarly, 1 tablespoon of sugar is equal to 1 apple, is equal to one slice of bread, is equal to half cup of oatmeal. Now these all are giving you 15 gram of carbohydrate. Now over here, when we are planning the diet for the diabetic also, we have to take care that which quality of carbohydrate we are providing them. Okay, like 1 tablespoon of sugar is a simple carbohydrate. It is also giving you 15 gram of carbohydrate, but it is not giving you any nutrient. It is just giving you the calories. Okay, and 15 gram of carbohydrate. Whereas one apple is also equivalent to 15 gram of carbs, but it is giving you other vitamins and mineral also, antioxidants also, and other nutrients also, along with the fiber also. So that is the difference when we do the like when we differentiate between the quality and the quantity wise. Okay. Similarly, for the fats, the examples are one exchange is equal to 5 gram of fat. So the examples are 1 teaspoon of oil is equivalent to 1 tablespoon of, or 1 teaspoon of butter, that is equivalent to 6 almonds. Then vegetables. Now one exchange is approximately 5 gram carbs, but it is a very low calories and it is considered to be negligible carbs only. So the example for the vegetables are your spinach, carrots, broccoli, cucumber, and half cup cooked veggies is equal to 1 cup raw veggie. So it's like this, we do the exchange. So in a diagram also, if you can see, one slice of bread is equal to one small potato. So all these can be exchanged. So we use this kind of exchange system when we are planning the diet for the diabetic, for PCOS, for insulin resistance, and for even for the weight loss, for obesity. So there are many metabolic disorders in which we use this. Now coming back to the examples. So now I am giving you one query. Just give me the, like you can sort it out and you can give me the example answer for that particularly. If a patient's lunch plan includes 2 starch exchanges, you can write down 2 starch exchanges, 1 fruit exchange, and 1 milk exchange. Okay, where your starch is equivalent to 15 gram of carbohydrate, your fruit is equivalent to 15 gram of carbohydrate, and your milk is equivalent to 12 gram of carbohydrate. Okay, so how many total gram of carbohydrate does this meal provide? So how we are going to calculate this? Anybody can answer? Should I repeat the question? Okay, it's a suppose if a patient lunch plan includes 2 starch exchanges, write down 2 starch exchanges, 1 fruit exchange, and 1 milk exchange. Okay, where your starch is equivalent to 15 gram carbohydrate, and your fruit is also equivalent to 15 gram carbohydrate, and your milk is equivalent to 12 gram carbohydrate. So how many total gram of carbohydrate does this meal provide?
Ma'am, 57.
Yes, so it is as simple as that. So it provides you 57 grams of carbohydrate. Now, when we are planning for the diet for the diabetic, over there we have to calculate the exchanges for the carbohydrate content. So as you have earlier also studied about the macronutrient distribution, so you came to know that after calculating like the 40% of your calories, total calories, come from the carbohydrate. So we calculated around like how much calories was like 560 something calories was from the carbohydrate. So after doing the calculation, we came to know that this much gram of carbohydrate has to be taken in a daily requirement. Okay, so from here we come to know that how much exchanges we have to use for to get those grams of carbohydrate in our diet. Okay, Any query related to this? I hope everybody understood this. Okay. So similarly, one more simple example, if I want to give, similarly, if suppose a breakfast includes like one slice of bread again and one banana and one cup of skim milk,
Yes, ma'am.
which milk exchanges 12-gram carbohydrate and banana is 15-gram and slice of bread is 15-gram. So again, we do the calculation and we find out that in total, in one meal like breakfast, 42-gram of carbohydrates are given. Okay, so it is simplest in that form. I hope everyone understood this. So basically, this is just the tip of the iceberg. It's a lot more underneath. And for learning all those things, if you are joining the course, then you will be learning every nitty gritty around all these things, very, very minute points, but very, very important when we are doing a diet plan for people suffering from diabetes or people suffering from PCOS or people suffering from obesity, weight management, for any case. So it is important part. So coming next to okay, coming next to the reading food labels. Now I would like to welcome Miss Dipali Verma. She is a clinical nutritionist and educator with 13 years of expertise in chronic disease management and public health nutrition. Now she will help us to understand reading food labels and common calculations in dietary practice. So over to you, Dipali.
Thank you, Binuji. Thank you so much. I hope I'm audible, guys.
Yes, you are audible.
Okay, great. Okay, so thank you so much for this introduction, Binuji. And coming to our last, I think, slides, but last, not the least one. So let's understand about the food labels now. Okay, like Binuji was talking about the exchange list, guys. Okay, now you can do the exchange and you can do the food, the calculations and everything in the amount when you are at home. What would you do when you go out? Okay, how would you read the label? How would you read that whatever you want to do in your calculations, because that is in the package size. Okay, so in the package, okay, when you are on the diet, when your clients are on the diet, how would you explain them that what they can do to make them more efficient and perfect when it comes to calculations. Okay. So we here talk about the food labels, reading the food labels. Okay. So when you get a pack, just a minute. Yeah, I'm so sorry. So when we do the food labeling, okay, so when you have a pack of everything, anything, like if you are having some sort of healthy chips like ragi chips or something, and if you're having something unhealthy chips or something, you are having a package, okay? Whenever you're having a packet of anything, if it is unhealthy or it is healthy, there are labels, okay? You can see there are one is the nutritionist fact, okay? Nutritional information is written over there, and the next is the ingredient list are there on the packet as well. When you see on the back side, you can see all the informations are printed there by the company. Okay. In that, you can see that there is some written carbohydrates, fats, cholesterol, protein, carbs, and total fiber, this fiber and that. What is that? These are the ingredients, these are the macronutrients. This particular packet is having. Okay. Now, when we know about that, how much they are, how much the carbs in this packet, there is a serving size. Okay. There is a serving size of all the packets. Some serving size is about 30 gram. It is written there on the packet. Some are written there 100 grams. So when they are written one exchange, okay, the amount of food defined as portion on the label, like when they are having an exchange, okay, the serving size. even if it is for 100 gram, even if it is for 30 gram. That means all those macronutrients counts that you see on the packet that are out of 100 gram and out of 30 gram. This is how you can read the labels. Okay, you can read the nutrition fact. Okay, suppose you are eating something like suppose it is like ragi chips or something. You are taking a packet outside, and on the back side you can see the nutritional fact, and out of 30 gram or 100 gram, this is written that this amount of carbs is there in that, this amount of sugar in that, zero amount of fat in that, whatever is written. That is the thing, whatever you are eating, okay, in that serving size, okay, that means you are consuming that sort of nutrient, that sort of calories, that sort of fat, carbs, and protein. Okay, so this is the serving size when you go outside and when you're taking any sort of food package outside your home. Okay, always mention the serving sizes. Okay, serving sizes are different for different packaging. So just be sure when you are on a diet, when you are calculating a diet plan for your client who's traveling, maybe they are using kakra, maybe they are using some, at something healthy, and maybe they are using something unhealthy. Just ask them to take you, to give you the labels, the nutrition facts, the ingredient list. Okay. The ingredient lists are also very important. Okay. Often people like skip the ingredient list, but that is also very important. Whatever the first is written there on the ingredient list, that is the highest amount in that. Okay. I have seen many healthy things are there, like they are selling out of like on a health basis that okay, this is very good, this is healthy. We are not adding any sort of refined flour in it. They are not adding any sort of refined sugar in it, but they are adding palm oil. Okay, a palm oil is like second and third ingredient in their list. Okay, they are adding lot of refined oils are there. Okay, so this is very important to take care of the ingredient list as well. Okay, now we come to the portion control, that what is the practical use when you see these nutrition facts. This is very important. First is the portion control. Once you get the knowledge of your facts, that what is there in the one cup, if it is 227 gram of a serving, this much amount of calories in that one cup you will get. Okay, so you can control your portions. Okay, you can control the calories out of it, and the macronutrients you can get. Okay, that how much fat in this, how much saturated fat in this. Suppose you are making a diet plan for a hypertensive patient, making a diet plan for a cardiovascular patient, so you need to know about the saturated fat. What percentage of saturated fat a person should have when they are having a hypertensive diet. Okay, so this amount you can get in that. Okay, that 23% of saturated fat are there, okay, which is the daily value of saturated fat. Like you can get the daily value, like the RDA value, 23% when you consume 1 cup of this particular product. Okay, and the gram of saturated fat is 4.5 gram. Okay, so this is RDA. This is not exactly the quantity of these ingredients. These are the RDA mentioned here, and how much you are getting according to the daily recommended intake. Okay, so this is how you can read the label, and once you read the label, you can easily maintain your diet, your client's diet, like energy management you can do, macronutrient balance you can do, nutrient quality. Okay, if it is not fiber in that product, you can easily deny it. Even if it has lots of fiber in some products, you can easily accept it and you can add it in your client's diet. Okay, vitamin D fortified things are there. Okay, some things are really fortified and modified by the so many things. You can do that one also. Okay, so and the product comparison, definitely what the product comparison is there. Out of 100 gram, what other products are giving you, out of 100 gram, what this product are giving you can do the comparison. Okay, and you can choose always the healthy. I would advise you, all the dietitians would advise you that please stay away from the packaged food, the processed food. But sometimes there are situations when we have to take this. Okay. So then these readings, these labels are come handy and you can do your calculations. Okay. Yes, you can just skip the slide, Timuji. Okay. Now the common calculations in our diet practices. Okay. Uh, Binu ji, Dr. Lakshmi, Ankita, they have talked about a lot about the calories, the calculations, and everything, and you have done the sum out of it also. Okay. Now here, these are the common calculations we do to take that how much you need. Okay, for you. All right, so let's talk about first protein. Okay, we know why protein we need. Okay, protein we need to make the muscle hair healthy. Protein is very important to make the nervous system healthy as well. Protein is like a building blocks of your body. So you will need protein in a very good amount. And there is a calculations for the protein that how much protein your body needs. Okay, so there is a calculations for this 0.8 gram per kg body weight. Okay, now you know that we all are here and making you the calculations. Okay, so let's ready for again the calculation. Just let me know that what amount of protein your body needs when you can just multiply 0.8 into kg. Okay, if you are not an athlete person who are not doing any sort of hardcore sports activities, this is the recommendation for you, 0.8 gram per kg body weight. So just quickly calculate your protein intake and give me on the chat. Suppose if I am giving you a percentage of 60 kg, good, Sinta. Suppose a person is having 60 kg, what is the protein intake for that person? It's a very simple calculations, I know. But it is for you very, very important to know the calculations, to know the formula. Okay? Yes, Suprita, 48 grams. Correct. So when we could talk about the athletes, the sports nutrient people, we need because they need more stamina, they need more energy, and protein is something to give you more energy. Okay, apart from fat, so they need more. So then it is 1.2 to 2.0 gram per kg body weight. Okay, so when you are making a diet for a person who is very active, okay, they're super active, they are sporty person, they are athletes, always make sure that the protein intakes must be fulfilled. Okay, then a person is having 1.2 to 2 grams per kg body weight, depending how much intensity they are doing in their workouts. Okay, I mean their sports activities, how much active they are, okay, how much water they are taking. Out of these balances, you can get that what amount of protein a sport person can get, and all this information you will get. Okay, we will let you know more about this information when we are doing the classes. Okay, so the sources are the meat, fish, eggs. These are the high biological value proteins. Okay, dairy, legumes, soya, nuts, seeds for the vegetarians. Roles, tissue repairs, muscle growth, enzymes, hormones, and immune functions. Okay, protein are very, very important to make the hormones work really effectively. Okay, some people get a depression symptom when their carbs and proteins, the ratio are imbalanced. Okay, so people who are having a mental health issues, they need a good amount of protein and carbs. The ratio should be very good. Okay, so this is the protein itself is really, really important. I don't need to explain this in a very elaborative manner, but definitely the protein is something that is really, really important. And the calculations you are getting here are the main source of formula. Okay, clinical, like if you are having any sort of like CKD, like chronic kidney disease and critical illness, obviously the protein intake depends what kind of illness you are having. Suppose a person is on dialysis, suppose a person is not on dialysis, the protein needs would be different for different people. Okay, ranges depends on the severity of your condition also and what stages you are on these sort of illness. Okay, if you are having CKD, if you are on the dialysis, protein intake gets really high. Okay, so that's why the difference in the diet would be there once you are doing a diet plan for these sort of people. Okay, so then we comes to the iron. Men 19 plus 19 mg per day and women 19 to 50 29 mg per day. Okay, why women needs more iron than men? Okay, anybody can answer why women needs more iron than men? Men have more muscle mass, men have more weight than us, then why we need the more iron the most? Why? True. Because of the menstrual cycle. We bleed every month. Okay. So we lost a lot of iron. We lost a lot of hemoglobin in that. So we need more iron to replenish it and to make our hormonal balance, hormonal system balanced. Okay. So not just the iron, when it comes to menstrual cycle, estrogen, progesterone and everything, protein, your amount of your fat, everything matters the most. But iron is a very key point there. Okay, that's why we need more iron, 29 mg per day. Okay, women 50 plus, we need 19 mg per day because after menopause, their menstrual cycle gets completely ended. So that's why they need 19 mg per day, less iron they need. Okay. Sources for the non-vegetarian people: red meat, poultry, fish, beans, lentils. Okay. Spinach, fortified cereals. And role is oxygen transport, energy metabolism, immunity. Definitely. It's really a long list of roles. It's not just the three part is there. There is a long list for iron. Now comes to the calcium part. Calcium and adults like 19 to 50, generally we give 1000 mg per day. Women 60 and men 60 plus, we need more calcium. Why they need more calcium? Because the bone density gets really low, okay, when they age. Okay, so because of the bone density gets really low, we need more calcium that time. Okay, their bones get really a bit weak. They need more calcium that's the time. Okay, but the calcium should not be in the form of supplementation because how much calcium your body can absorb, it is very, very important. Okay, otherwise you will excrete the extra calcium. Okay, so it is really, really important. Absorption of calcium is really, really important. Vitamin D level should be very, very important that time. Your fat, how much healthy fat a person is taking is very, very important. Okay, so it's not just about the grams, the numbers. Uh, Here it's not only about the nutrition is not only about the number. Nutrition is all about what is inside in your body and how well you are dealing it, how well you are maintaining it. Okay, then only you can absorb all the nutritions and the numbers. Okay, sources: dairy products, fortified plants, milks, leafy greens, tofu, almond. These are for the vegetarian people. Okay, and obviously bone health, muscle health, contractions, nerve. This is very, very important. Like for calcium, it's for your bone health, for your muscles contraction, and your teeth, everything. It is a very important role of calcium. It's building the skeleton, building the frame of your body healthy all the time. Fiber is not why fiber we need. It is just because we can't get constipated, and it is very important that your body gets, a very good amount of healthy gut. Is the fiber is only for the gut? 30 to 38 gram per day we need for men, and women 21 to 25 gram per day. This is the number for the fiber. Fruits, vegetables, whole grains, legume, nuts, and seeds are there for the sources for fiber. Okay. Improves digestion, lower cholesterol, supports blood sugar control. So it is not, most of the people ask me when I do the diet, and madam, I don't have constipation. Why do I need to increase my fiber intake? Lots of time I get this question. So it is not just because you are constipated or you are not constipated, it is because it improves your cholesterol level. This is a very, very important function of fiber, that your cholesterol gets better. And most of the time when we are doing diet for the Indian people, you see their cholesterol are always, most of the time their cholesterol are like imbalanced. Sometimes their LDL is really high, sometimes their triglyceride is really high, sometimes their HDL is very low, sometimes HDL is really high. So balance is important. Okay. So yeah, you can just skip the next slide, Binuji. Now coming a very interesting part, glycemic index and glycemic load. We were talking about the diabetic type, right? And you have heard about glycemic index a lot. Okay. So if I ask you a question that one roti gives me a glycemic index of very low, suppose it's like 50 around, 50 to 60 around. Okay. We can have that roti. Okay. We can have the wheat flour. Okay, one roti I'm having, right? And if I generally have, like, my appetite is just for two roti in a day, but sometimes the food is really tasty and I eat like three or four roti. So if I am a diabetic person, will it raise my blood sugar or not? Comment, I mean, just message me, just chat me if yes or not. If I eat more roti, okay, my blood sugar will rise or not? Yes? Why? Tell me why. Because the wheat flour I'm having, it has the same glycemic index every time. Then why my blood sugar is getting raised? Because the load is
because
getting
of the
higher. The name itself suggesting, yes, the name is suggesting everything. Okay, glycemic index and glycemic load. Okay, this is an index, this is a number that once you eat this kind of food, the number is suggesting how much your blood sugar will get rise after consuming this amount of this particular food. Okay, load is suggesting how much load it is giving you. Okay, like the amount you are eating. Okay, how it is increasing your blood sugar level. Okay, so now your blood sugar is getting loaded. Okay, it is giving a load. Okay, so that is a glycemic load and that is a glycemic index. So always remember, once if you are confused, because sometimes I was confused when I was doing my master's. What is the difference between the index and the load? Index is just a number, okay, that this is much your blood sugar is getting raised, and load is how much load that particular amount of food is giving you on your blood sugar. Okay, that's why watermelon has the highest glycemic index, but the glycemic load is really low. Okay, the mango is having a very high glycemic index, but if you take it in a very particular amount, the load would be really low. Okay, so that's how we do the carb counting as well, and that's here the picture comes when the diabetic diets we are planning, glycemic index, glycemic load, and these are very very important things when it comes to prepare a diabetic diet. Okay. So these are the numbers like 55 and below. This is a low, 56 to 69, the medium, 70 is high. So the low value we should consider when we plan a diabetic diet. Medium value we can do moderate. Okay, high value we should avoid. Okay, 10 or less low value load you can do. Below 11 you can do for your diabetic clients. More than medium is like occasionally you can give, high completely avoided. Okay, and glycemic load is not just only about the numbers, it's about how much amount you are giving to a person. Okay, then it can give you a proper number and proper instructions that what is there when you are giving certain amount of food to the person, what is the sugar spike after that. Okay, so yeah, this is glycemic index and glycemic load. Binuji, you can skip it. Now, distribution of macronutrients according to the total daily energy intake. Okay. Nutrition in children with type 1 diabetes instruments in the management of the disease. Dietary recommendations for diabetic children are same as for healthy children accordingly. Okay, this is like about how much percentage you are giving to your macronutrient. Okay, these are the set guidelines by the ISPAD. Okay, like 45 to 50% carbs we need to give, 15 to 20% protein we need to give, 30 to 30% fats we need to give. Can anybody tell me why the fat is higher than the protein? Protein we need to give higher, right? Then why we are giving the fat high? We generally cut down the fat. It's a myth. I don't know. It's a truth. I will let you know that most of the people say when it comes to diet, just cut down the fat. Just cut down the fat. Why we are giving fat here the more emphasis than the protein? Why? Anybody can unmute himself and just answer it. Nobody? Okay, I'll tell you. When we talk about protein, okay, it is 0.8 gram, okay, per kg body weight, right? When it comes up the protein calculations, when you give the highest amount of protein and the carbs is also there, and a person is insulin resistant that time, the carbs, the protein, the high amount of protein can get stored into your body. Okay, too much of protein can mimic like a too much of like a carb value. Okay, it mimic like more and can it mimic like your carbs and it can raise your blood sugar levels. Okay, that's why generally we keep the 45 to 50% carbs, but the carbs quality should be more. The fiber intake is there. Okay, not the simple sugars. You have already learned about the simple sugar, like Dr. Lakshmi and Bhuvanesh have talked about the simple sugars and the complex sugars. Always make sure that whatever you are making for your client, just make sure what exactly that person can eat. Okay, if you are giving that person a highest amount of a protein and something a person is not able to digest it, it will go and spike the blood sugar levels. Okay, because we are giving here the highest amount of protein according to the calculations, the percentage we have keeping low here. And 30 to 35% fat is good amount. Why? Because we are not generating like 0.8 something per kg body weight. We give a minimal amount of fat here, like 15 gram of fat, okay, 20 gram of a fat or something, and 1 gram of fat is of 9 calories, okay. And the healthy fat we are talking about here, not just the unhealthy fat. We are talking about the healthy fat, like the MUFA and the PUFA as well. In the PUFA, you can get the omega 3, omega 6, okay. And if your patient is having some sort of inflammation, omega 3 is a very good amount, okay. Omega 3 rich diet can work wonders for your uh, diabetic patients. Okay, people in the US raving about the Mediterranean diet today. Okay, they are really, really happy with the Mediterranean diet. Mediterranean is an anti-inflammatory diet. Basically, most of the time, MUFA and omega 3 fatty acids are used in making the Mediterranean diet the most. Okay, so that's how if you reduce the inflammation and you follow a particular amount of balance of your macronutrients, you can get result very greatly. Okay, you just don't need to just cut down the calories. You need to balance all the macronutrients. Okay, so if you balance the macronutrients index here, that can maintain the glycemic control. Okay, you support growth and development, prevent overweight and obesity. Okay, the key practices of frequency should be 3 main meals plus 2 snacks, but it is very standard. You can get it according to your client's need, your needs as well. Okay. Regular meal time routine, breakfast, 30% of daily calories, dinner, 2 hours before bedtime. This is very, very important. When you're having dinner, 2 hours before your bed is really important. Otherwise, person who are having diabetic, if they immediately having the dinner, if they're having late dinner, and they immediately go to sleep, their blood sugar spikes get a lot. Sometimes they go into hypo as well. I have seen people. Okay, so their blood sugar spikes can get imbalanced a lot if they have no gap in their dinner and their sleep timings. Okay, so this is all about today's workshop. Over to you, Benuji.
Thank you, Dipali, for such an insightful discussion regarding the labels and the macronutrient distribution also. So next, we will be talking about, as I have earlier discussed, as I have earlier told you that today, whatever we have talked about, that is just the tip of an iceberg. So if you want to dive into deep understanding all the calculations and how nutrition science work with the numbers, so the course is there. That is your the title of the course is your Nutrition Algorithm Mastery. And this course major objective of this course is basically focused on the nutrition calculation, and it intends to furnish students with the competencies to assess BMI, ideal body weight, total energy expenditure, along with recognizing nutritional requirements, implement anthropometric and dietary evaluation. Now, in anthropometry also, how to learn to assess the body parameters such as your BMI, skin fold thickness, waist hip ratio, and dietary recall method to evaluate nutritional status. And then the very important part, meal planning, acquiring the skills to utilize food exchange list for meal planning and to create meal plans that address specific requirements, including therapeutic diets for conditions such as diabetes, cardiovascular disorders. Then foster the capability in carbohydrate counting along with the examination and understanding of the reports in clinical conditions. Now, understanding of the reports is also very, very important. And again, it is the play of numbers. So this course is the duration of the course is for 2 months, and the frequency is 1 class per week. The class will be for 1.5 hours, and all the eligibility criteria for this course is nutrition and health professionals and students. So the price of the course for the students, for the professionals and international students, it is over there in the slide. And a very good news for all of you is that for the early birds, we are giving a 10% discount on the early birds for this course. So next, when we are talking about the course, as I have already discussed about the objectives, so these are the basic, all the 6 modules, counting for the energy requirements, macro and micronutrient distribution, nutritional assessment tools, weight management, meal planning, exchange system, food exchange system, food labeling, and then clinical nutrition. And as today we have all faculty have been introduced to you, Dr. Lakshmi Kulkarni, Ms. Tanveer, Ms. Ankita, Ms. Veenu Bhatia, Ms. Dipali Verma, and Mr. Saurav Kumar Gupta also. So all those faculties are from the nutrition and dietetics background, which will be taking this course. Now, the module-wise topics and subtopics. Over to you, Ankita. So we can have a brief introduction of this topics and subtopics of the course.
Sure. Thank you so much, Binu. So I would just firstly like to thank everybody to stay till the end and understand the importance of calculation and the different applications. Obviously, since this was a workshop, we couldn't apply too many things. But when you go deeper into the courses, basically we will be taking like, a lot of case studies, like in terms of, I'm not going too much into detail about reading this because we've already covered that what we will be covering in energy requirements is the BMR, the Harris-Bendel equation, and then the TDD, how to calculate the TDD, but we will make it more into the application aspect specifically. Same way when it comes to macro and micronutrient system, we have discussed about the base percentage, but we will be giving you more case-based scenarios, more practical application, and a combination of, say, for example, a particular person is coming from this background, particular coming is from this background. How will you plan a diet based on that? Because this is just a theoretical knowledge. When it comes to practical implementations, there are various factors which we have to understand and then calculate or plan a person's diet. So doing a course on practical implication is more fruitful for you all, because it will all, sharpen all your skills in terms of planning, tweaking the diets. And we all are in the world of personalizations where even a chat GPT can give you a diet, right? So why will somebody come to a professional like you is the question, right? So if you want to master this into personalization, and that's the reason it is a very it makes sense to go into a deeper understanding about the different aspects of how to plan diets into various case scenarios and then give into personalizations, because which a chat GPT may not do, because a chat GPT may not interact as a human touch with a person, but a client coming to you is in a constant touch with you with a human touch specifically. And that's how your progression diets, your playing of your numbers will play into the role if you understand and have that practical implementation. So same way, we'll be going more deeper into the nutrition assessment tools. This is more pertaining towards when you're working into a public health sector specifically, not on an individual too much, but yes, basic body composition, waist to hip ratio is ideal body weight is something which we will be doing into obesity, which is the most commonly used scenarios in today's day. But as a coach, I would always tell you to go one step deeper and understand the client aspect, and from the all 360 degrees, plan the diets. It's even a chat GPT will give you a diet today. So what is going to outstand you as a professionals? from the chat GPTs, what you'll be learning with the more practical approach in terms of having empathy in your counseling skills, also how to calculate. I mean, there's the theoretical part, but the practical application, if say, for example, if I do not, if I am not a person who wants to eat, or maybe like a scenario, say a South Indian client coming to you. Now, when you understand the food exchange list, when you understand that, okay, one chapati, half katori rice, one bhakri, all will give you the same amount of carbs and calories. But how do you tweak into the religion and cultural basis of a client is something which will help you for more practical application. Same way, I'll hold on to Dr. Lakshmi for the other clinical aspects and the meal planning exchange. Look at what would be the different applications which you'll be learning about it. Over to you, Dr. Lakshmi.
Yeah, thank you, Ankita. So whatever we have learned, we just learned the superficial part of the nutrition. As I told in the first, when I open the class, so whenever I think about the nutrition, first thing comes in our mind is the calculation. It is not just the diet plan. It is not many things, food exchange table, how to use food exchange table, meal planning technique, and along with the case studies, you will be learning how to implement this food exchange table and what is the calculation percentage of RDA as per the FSSI. So all this you are going to learn in depth in the course what you are joining. And not only the meal planning exchange system, but when it comes to the clinical nutrition, the diet is entirely different when it comes to the medical nutrition therapy. The medical nutrition therapy has the many things. There is a diabetes, PCOS, insulin, thyroid. And when it comes to the diabetes, again, there is a lot many calculation, I must say, carbohydrate insulin ratio, insulin to carbohydrate ratio, which we particularly use in the type 1 diabetic to reduce the calculate the doses of insulin. Suppose the rapid insulin, if you are taking small acting insulin, if you are taking, how much insulin needs to be injected to lower 60 mg per dl sugar levels. To increase, if the person is going into the hypoglycemia, then what is the insulin that we are going to inject? How much insulin that we need to inject? All this that we are going to discuss in the diabetes. Coming to the PCOS, how the insulin resistance and PCOS are working, how the weight loss help in reducing the PCOS, what is the impact of weight loss in regularizing the hormones, that you are going to discuss. CKD, entirely a depth knowledge that you will get. There is a separate calculation for dialysis and the non-dialysis. What is the protein that you need to take if the person is on dialysis? Then whether are we giving the low protein? If the person is on the non-dialysis, then how much protein that we need to give? Dialysis person requires high protein. Then how much high protein that we need to give? And potassium. Exactly what is the potassium, lower potassium diet? What is the sodium restriction that we need to give? Phosphorus restriction. How to balance the fluid considering the urine output. These are the things that we are going in depth when it comes to the CKD. Thyroid, how to balance the TSH, T3, T4. Iodine, how it is working, what is the percentage of zinc that we need to give. Liver diseases, when it comes to the liver disease, are we supposed to give the high protein diet? What is the non-alcoholic fatty liver? What is the requirement in the alcoholic fatty liver? If the person has go into the ascites, what is the fluid restriction? What is the salt restriction? These many things that we are going to discuss, and each and every organ has the separate calculation, guys. Till now, what you have learned, it is just the superficial, and the medical nutrition therapy is really has the depth to learn many more things when it comes to the medical nutrition therapy. All this we are going to cover when we are doing the certification courses. So these are about the module that we are taking. Any doubts, you can ask us. So far, what you have learned, if you want to share any feedback about the workshop, if you are taking something from today's workshop, you can share it. And it was lovely interacting with you all, and super happy that you have involved in the many calculations and enjoyed the number games here. It is nice to have you all in the session. Thank you.
Thank you, Dr. Lakshmi, to explain the modules. And thank you for your active participation. And again, I would like to say that remember, nutrition calculations, they are not just the numbers, they are the code that unlocks your healthier choices for individuals and communities alike. And so keep practicing, keep questioning, and keep cracking the code. That is the only solution for this. So any query you would like to ask, you can ask in regard with the workshop, in regard with the course. Okay, another thing, if anybody is interested to register for the course, you can register, you can get the link or the registration things from the group in which you are already added. Okay, thanks a lot again for your active participation. And I would like to thank all our speakers also for their active participation and for enlightening the whole session. Thank you, everyone.
Thank you so much, team. Sinta, Krish, do you all have any queries?
No, ma'am.
So can we
So much,
expect you to
guys,
see in the course
joining the session,
for
joining the
learning?
workshop. Thank you so much.
I think there are no queries. We can end the meeting, I guess.
Yeah, we
Yeah,
can.
so we can conclude the meeting
Yeah,
and
yeah, we
hope.
can conclude the meeting. It is 9 o'clock. So,
Okay,
all
thank you,
right.
everyone.
Yes.
Okay, good night.
Bye. Good night. Have a
Good
good day.
night. Bye, everyone.
Thank you, guys. Great work. Thank you. Bye bye.